Central sulcus of Orlando. So, automatically, you must know which one or which hemisphere is right or left. Look at the blunt frontal and the pointed occipital. So, this one is what? Right or left? Right, okay. Now, it would be very insulting to you if I will ask to identify frontal lobe, temporal lobe. You want that? Yes. Okay, frontal lobe. What about this one? What? Answer. Parietal, frontal, occipital, what? Parietal. Oh, this one. If I will put a pin across this, suppose there is a pin all over this cortex, around the thalamus and corpus callosum, all of this. What do you call that structure? It's a lobe. Limbic, correct. Suppose this is the sylvian fissure is separated, showing you that floor, insular lobe. So those are the 4 lobes. Next, your list, okay? Mga kayo, give me a list. List of the things that I will be discussing this afternoon, okay? You see this one? This is the medial aspect of the right hemisphere. You see this structure here? Yes. Obviously, this was cut, and this is the main connection between the 2 hemispheres, right? Corpus. Oh, what is this? Corpus callosum. What type of fibers? Projection, short association, or commisural?
Commisural.
The entire thing, embryology naman, the entire thing, the hemisphere was derived from telen, dien, meten, mesen, myelin. Oh, let's leave the no Brodmann area first. Initially, no Brodmann area. Okay? Generalization. So we'll through with telen. From this view, I have only 2 members of the diencephalon. Pint. Thalamus. From dien. What is this actually? A group of sensory relay nuclei. So the first one is thalamus. Okay? Thalamus, singular. The other one is this one. Hypothalamus. Okay? Hypothalamus. Just below the thalamus, because this is the anatomical position, right? So it's slightly below and it's separated by sulcus. But remember, this is the hypothalamus. No need to elaborate. Get it? Now, this one is called septum pellucidum. Never mind. Don't know this. Just a membrane. Again, this is corpus callosum, right? These structures, the fornix, it's not included yet. Okay.
Brainstem.
Know which is ventral and dorsal. Automatically, aspect. This one is your ventral or dorsal? Ventral, because of the swelling or the swollen pons, ventral pons. Alright? And the although cut cerebral peduncles, isn't it? Crus Cerebri. And in the medulla, pyramids. Alright? But question for embryology will be, for example, pin structure, midbrain, thalamus, midbrain, pons, medulla. Midbrain. From what secondary? Vesicle? Mesen. Mesen. Not telen, not dien, but mesen. Not, what's the next? Meten.
Meten.
And myelin sheath. Myelin. Alright? The same thing here. Diencephalon, midbrain pons, pons, medulla. Pons. From meten. Myelin. Okay. From up down. Telen, dien, mesen, meten. Telen. Mesen, dien, etc. Dien, because the thalamus, right? There. Sunod naman yan eh. Mesen, because this is the midbrain in this view. And that is the pons, meten. That is medulla, myelin. Alright? From mesen, from telen, dien, meten, mesen, myelin. Meten, because this is cerebellum. You know, cerebellum develops from meten posteriorly. Anterior is to the pons. Loose dura. This is the Dura Mater. There are loose dura detached from the brain. You have them, right? The most important artery in the dura is called the middle meningeal artery. Because there is a posterior, there is an anterior and posterior. The real middle meningeal artery is the one that is clinically important. Why? Yes, because this is the one that is usually ruptured in a fracture of the skull in the weakest area called Ptenion, right? The weak area which is the meeting point between the bones, frontal, parietal, temporal. That is weak. So kung may blow ka dito, usually what happens is the skull fracture will rupture this vessel. Because these vessels, you can see there are, you look at the inner aspect of your skull. You have no skull. There are impression or tunnels for these arteries, right? See the intimate relationship? So a fracture of that inner aspect will rupture this. And the bleeding will collect outside the dura, which is called Epidural Hematoma. And that is an emergency. You know that. Now, bleeding usually of venous origin, there are veins under the dura. Subdural hematoma. The bleeding is rather gradual. It takes a time to develop and increase the cranial pressure. So, subdural is venous. This one is arterial. This is more serious. And in an emergency situation, requiring immediate evacuation of the blood in the extradural space, which is between the dura and the skull. Alright, middle meningeal artery. The dural venous sinuses. For example, this one is your superior sagittal sinus, the confluence of sinus, transverse sinus. There are so many. We don't have to discuss them right now. Okay? And the reflections, you have Pulse Cerebri, Pulse Cerebelli, maybe one question from those reflections. This is the entire thing, the dura. The next, now the dura is a loose covering, can be detached. The next is the arachnoid. It's another loose covering. This part has no more arachnoid. So this is your arachnoid that can be stripped off like a spider web. Ay, arachnoid eh. So the pin must be like this. Okay? There. Can be pin, right? Oh. Arachnoid. Now in life, beneath this is an actual space. You call it
Arachnoid.
which is filled with CSF. And then the next is Pia. Pia cannot be stripped off the brain surface. It is a part of the brain already. It's the external limiting membrane of the brain. It follows all the contours of the brain faithfully, even the spinal cord. Cannot be stripped off. So no way to demonstrate Pia. Pia, guanyo, pwede.
Pia words.
Yeah. If you look closely, there are like fungal growth, like small cauliflowers here. Oh. Can you see them? Cauliflower, parang bulutong na maliliit. Here at the region of the superior sagittal sinus, Because in life, these bulutong are projections that opens or that drain into the superior sagittal sinus. In life. There, oh. This is called the arachnoid granulations, or when especially large, the Paconian bodies or their function. Drainage of CSF from the sarapnoid space, subarachnoid, to the venous sinuses, venous blood, systemic circulation. Ventricles. This is a coronal, horizontal section. All right? Front, back, frontal, occipital, corpus callosum. In another view, uncut. Oh, all right? Ventricles first. Pin cavity, or cavity where you cannot pin a cavity. A cavity where the pin is placed. A, lateral. B, medial. Hindi. Lateral. Third. Fourth. Item. What? Superior? Wala naman superior. Lateral. Okay? Now, in the medial wall of lateral, you can see again vegetations. In quotation. Growth. This is your choroid plexus. The source of your CSF. It was also found in the roof of the third ventricle. This is the third ventricle. And the roof of the fourth. Choroid plexus. There. Let's go to ventricles. Number one, lateral in a frontal section. Thalamus. Thalamus. Thalamus on the left, thalamus on the right. Thalami. Alright? The thalami are the walls of a slit-like cavity there, which is called your what ventricle? Third. Slit-like eh. So this is your third. So here you can clearly see there is a connection, interconnection between the lateral and the third here, which is called interventricular foramen of
Monroe.
So we have lateral, Monroe, third. Next is the midbrain,
Brainstem.
because you have your Crus Cerebri, and posteriorly you have your Corpora Quadrigemina. Four with four breast. Apat, juging apat. Right? So this is the posterior aspect of your mesencephalon or midbrain, right? So the midbrain was sectioned. There. In the section of midbrain, you have your cerebral peduncles, right? Anterior. Then you have, never mind the next, red nucleus, then the tectum contained in the corpora, isn't it? Now, you have a narrow cavity at the region of midbrain. This is your? Ano? Midbrain, narrow cavity. Cerebral Aqueduct of Sylvius or iter. This is one view, another view is medial. In this view, you have thalamus. So, if you remove the neighboring thalamus, you reveal one side or one wall, which is the right wall of the third ventricle, right? The thalamus. And then this is the region of midbrain, pons, medulla is removed. Can you see this narrow cavity here at the region of midbrain? Okay? Oh, that is your iter also in another view, long section. Midbrain, there, you can see the cavity, the narrow cavity inside, isn't it? For the fourth ventricle, this is not taking into account central canal of spinal cord, that's easy. Central canal of spinal cord, we discussed in spinal cord, so don't include that yet. Fourth, last cavity is the fourth Fourth ventricle is defined as a rhomboid-shaped cavity bounded by the cerebellum, but posteriorly, but the cerebellum is removed. At the region of, or bounded anteriorly, or the region of Pons, Medulla. So this diamond shape with the floor is your fourth. Get it? A better view is lateral. Rhomboid-shaped cavity bounded by anterior by the Pons and Medulla, and posterior by the cerebellum. No other. This one. Okay? So we're through meninges. Limited stock of actual specimen. Use your computer. LCD examination. The typical ones are internal carotid. It's very easy to locate internal carotid in an intact brain, meaning the two hemispheres are not yet separated. Try to look for one with a short stump, internal carotid. Then the two branches of internal carotid, one is showing here. This is the medial aspect of the right, isn't it? Now, there is an artery that covers or supplies most of the anterior aspect, except the posterior one. The posterior one is supplied by occipital. Posterior, cerebral. But this one is showing here, which supplies the rest of the medial. So this is the main supply to the medial aspect of the cortex. This one is called the anterior cerebral artery. O, this one, sigurado yan, ha? Sure ball on the medial aspect. Why? If this is clinically, if this is occluded, you will have infarction on the medial aspect. Since the medial aspect represents the control in terms of sensation, sensory and motor of the lower limb, because the lateral is for the upper limb, the rest of the body, but this one is upper limb. You have loss of sensory, sensation, general, no? And paralysis of a lower limb. Which one? Opposite, same side. Opposite, because both your sensory and your motor is a cross track. Get it? So sensory motor loss of the opposite lower limb. Remember that. Good for ABCD. The other one is middle meningeal artery for extradural hematoma. Middle meningeal artery, no more time to show you. You separate bit. No, remove the dura. The lateral fissure, it runs in the lateral fissure and gives off these branches. That is the middle cerebral for the rest of the body, upper limb and body. Okay? Posterior cerebral, never mind, that's for tissue. Internal carotid, there, oh.
Internal carotid.
A short segment was caught, was captured. You see it? There, oh, the stump. There, oh, where moves. Oh, halo siya, di ba? This is a small segment of internal carotid artery. Then gives a branch to anterior and middle cerebral. Now, there is an artery that runs on the ventral. This is the ventral or basal aspect of the pons. This one, oh, kaya lang putol, was cut. What do you call this? It runs in the base of the pons, basis pontis. Basilar. It is formed by the union of what? Two arteries on both sides.
Vertebral.
The arteries that run in the intervertebral foramina of the cervical vertebra, right? And then it divides in the formation of Cerebral Aqueduct. It is formed by the union of two vertebral arteries, but it divides in the formation of Cerebral Aqueduct into two divisions. Posterior.
Cerebral.
Posterior cerebral, posterior communicating. Oh, I forgot. You review that. That's your side question.
Communicating.
Oh, communicating. I'm right. Oh, okay ng review. Ha? Pin structure. Magagaling dyan. This is again frontal or coronal section. Pin structure. Connecting. Main connection with Corpus Callosum. The space. Taka, mawawalan ako ng boss. Ha? Lateral. O the vegetation, the growth. Inside. Choroid plexus, the source of Csf. Likewise in the third. So this is your interventricular foramen of Monroe. Thalamus. Thalamus, third ventricle, isn't it? This one, don't ask me, it's the pineal gland. Never mind, we don't have that yet. So thalamus. Okay? These are your basal ganglia, no? The medial one is your... Correct. Thank you. And the lateral one is the putamen, but we don't have that yet. That's
Okay.
basal ganglia, right? I'm just showing you the thalamus. There, that's the correct position. The thalamus and this on the right side, the thalamus and the head of the caudate nucleus are separated medially, no, from the two lateral structures, putamen lobes, by this internal. That's where this one your ball tip, internal capsule there. What is an internal capsule? Gray matter, white matter. Of fibers going to and from the cortex. So an infarction of the fibers here will result in many sensory motor loss. Internal capsule, this cortex is what?
Insular.
Correct, because this is your lateral ventricle. You
Brain
identify.
stem review.
Oh, here first.
अरे यार ये क्या कर रही है?
Identify. Letter A, thalamus. Letter B, midbrain. C, pons. D, medulla. C, automatic. Thalamus. Midbrain.
Yes, midbrain.
Those are your Corpora Quadrigemina, Cerebral Peduncle. This one is no problem because it's swollen. Pons. Of course, below the pons it's medulla. That's enough.